great to see you, Prof. Thanks so much for taking the time to be with us today.
Good morning, Leanne. Absolute honor, and thank you. And thank you for raising such an important topic, which I think is very critical to this nation as well as globally at this moment.
Yeah, you know, it's quite incredible. I think we have this conversation so often about World Mental Health Day and mental health issues, but I almost feel like it's never been more important, because at this point, you know, you look around and the amount of people that are struggling with some form of mental health illness, it's incredible how badly affected people have been by what we have just been through.
Absolutely, Leanne. When the world says the fastest and the biggest pandemic in the world is mental health, 1 billion people in the world are diagnosed with mental health. So these are diagnosable mental health conditions. And that's the magnitude we are talking about. In South Africa, we see 16.5% of the entire population, as per our WHO 2020 report, that 16.5%, which is a huge population, that is suffering from mental health. 1 in 5 youth in South Africa suffers from mental health. So every 5th young person is at very high risk to mental health condition. 4% of our youth has severe mental health disorders. And these are the things that we are trying to bring together. So this is real. This is in front of us. Stigma makes it far more worse. 75% of all the cases of mental health start before the age of 24, which means the onset of this mental health disease is a young person's disease. In fact, 50% even start before the age of 15, so which is at the high school level rate. So obviously, universities, schools, young people, and the focus for today, from my perspective, has been it's a real disease. It's around us. Yes, COVID has just brought it into reality, but it always existed. We need to break the stigma of this disease. And young people are extremely vulnerable where the onset starts. And I think we need to bring awareness and education far more earlier now in order for us to overcome this pandemic if we have to and we want to.
Yeah, it is fascinating. I mean, I've heard, let's sort of take it back to being a child now, because if we perhaps intervene earlier, it may help. I mean, I've heard children I don't even want to guess an age. You can tell me the ages of perhaps the youngest case that you've seen, but I certainly have seen very young children that have been diagnosed with some form of a mental illness or depression. And this is where you worry, because you think that, you know, children are okay, they fine, don't worry about the kids, they're happy. But it doesn't seem to be the case. So let's start from those very early formative years. What should we look out for in children if they are in fact going through depression? What is leading them to suffer from depression? And why is it getting younger and younger?
So definitely many reasons, you know. One is genetic. Mental health is also a genetic disorder, in the sense that it is that if your parents are prone to, or if you're genetically prone to, mental health does manifest at a very early stages. But the other bigger issues are acquired issues, you know. So when you have a genetic predisposition to mental health, the acquired stressors, and let's talk about South Africa now with the acquired stressors. South Africa is a young country with just 27 years old, a country which has inherited a very difficult past. Most of our young people are born of single parents. They've seen abuse right from the young ages when they're growing up. That's a reality. Financial distress in the families, trauma and abuse around, which brings a young person's development at a very young age with an acquired stresses around him or her, which builds from the very young age what we call it as a psychological distress around him or herself when the child is growing. Comes to a phases of growth, enters into high school, and specifically when it flares up, which is after the age of 17, 18, as what the data suggests, is when you leave your guardian control or parental control into a new world, academic stresses, financial distresses. These are all phenomenons that are around us as society, as a reality of South Africa. And that's why mental health in young people becomes far more severe and far more early onsets for us to now start diagnosing. Symptoms are very clear. Um, um, Very little attention to detail. You see the child, usually the first start symptoms are when the attentions are not there in the academic classes, your results or marks are coming down, you start seeing the child isolating him or herself, you see difficulties in sleeping, eating challenges where the child is either not eating or eating too much. So these are a lot of factors one has to observe as a parent when you are, or a guardian when you are around young people, so that at that moment, because the problem with mental health is not being diagnosed. If 70% of South Africans go undiagnosed in mental health, and specifically in the young ages, 80% in underdeveloped countries, 50% even in developed countries. So the biggest challenge is diagnosing mental health. A lot of people themselves feel they will fix it themselves, which is very difficult or possibly impossible. And any disease, Leanne, whether it's COVID, whether it's blood pressure, whether it's diabetes, whether it's cancer, if found at a later stage, it's very challenged to get it back because it becomes almost irreplaceable. The best way is to diagnose everything early, and mental health is no different. So early diagnosis is critical, and that is why breaking the stigma, making cultures and societies understand that mental health is real, it's a disease in general, and early interventions will help.
Yeah. You know, I mean, I can't help but think about a very, I mean, there are so many cases, and there are cases every single day of, you know, we've spoken from the very young age and then going into those difficult times that you're talking about where, you know, we're getting into the high schooling ages and then going into university. And then, of course, as an adult, it manifests. But there was a very devastating story. I think it happened about 2 weeks ago here in Johannesburg at a school in Johannesburg where two young girls actually jumped from the school, from I think one of the buildings at the school. I don't want to go into too much detail about that, but they were both 14 years old, and the one girl did die. The other one was admitted to hospital. I'm not sure, you know, what the story is on that side, but you know, psychologists were brought in. They were speaking about cases of depression, cases of bullying, cases of, you know, social media, cases of all of these kind of things always came to the fore once again. And there are a lot of pressures that are put onto our children. They really are. Things that perhaps you and I didn't have in those days. I mean, we didn't have these devices that are there, that have the world on them, and everybody's just on there anonymously bullying and doing whatever they want to. But the strain that it's taking on our youth is a pandemic in itself. This is a very, very scary situation we're finding ourselves in. How do we try and assist? How do we assist our children through this?
Absolutely, Leanne. Just to start by saying that for one suicide death that we see, there are 20 attempts of suicide on average. So it's not just about the life that we lose of a young person or a person in general to suicides. WHO says that every 4 seconds in the world, we lose a person to suicide. That's the magnitude I'm talking about. And then just imagine 20 attempts. So it builds into a human body continuously, builds into your mind. This decision of taking your life it builds from a very grievous injury into your brain. And I think that's where you are asking a question, how do we prevent that for a situation, not only from a suicidal ideation, which is starting thinking about attempts, to the actual phase of suicide. And that can be preventive if people understand what is mental health. If mental health education starts, I'll give you a predominant example from my own system of higher education and higher health. We've gone to a level where we've seen the pandemic to such a level that we've actually now put a curriculum on mental health. It's a co-curriculum program. Last year, we had about 170,000 students enrolling into this curriculum. I'm very happy that at least young people are opting to use this as a curriculum and a participatory curriculum, more peer-to-peer driven, more in a phase of let's one teach, one person learn, one person teach the other. That's the right way to break the silence of mental health or break the stigma of mental health. Mental health stigma has to be broken so that early diagnosis can be made. We have fantastic tools where we can put early risk detection among young people. About 90,000 odd students last year did those risk detection, of which 24,000 young people were put through some care because they showed signs of psychosocial distress. What I'm seeing is these are not numbers that never existed in the past. These numbers exist even today. But the question is, at least there is some way we can early get them the knowledge of mental health, make them introspect. Maybe they are at early stages of psychosocial distress. There is help around. Can we link them to some kind of help? And can early interventions help? And Leanne, maybe I'll use this opportunity to market a number. It's a toll-free number with 24 hours, totally free, 086 0860363636. So 0860363636, a toll-free 24-hour helpline anytime in a day. If you are suffering from even a small ideation of suicide, you have some kind of psychological distress, there's no harm. There's a psychologist, there's a social worker who will attend your call, will direct you, will guide you. And it takes about 3 days to resolve a crisis. And that's fine, because that's the way it has to start. And it has to end to a level that this person does not take a step that unfortunately makes us lose a life. So things are possible. It's just this awareness and education that's very critical.
So I'm going to say that number again, and perhaps I'll ask my producer if she doesn't mind putting it up on the screen so you can write this down. If you are feeling any kind of way, just phone and speak to somebody. It always does help. 0860363636. Finally, Prof, before I let you go, it's amazing how we speak about these things a lot more. And I'm so happy about that because, before we never spoke about these things. These were silent battles that we would fight. I mean, I remember when I first had a panic attack. And I've suffered with them ever since for a very, very long time, but I have them under control. I didn't know what this was. I couldn't understand what the problem was. And I sort of, thought I was going mad in my head, and I kept it to myself. And anybody that I told thought, just get over yourself and pull yourself together. It doesn't work that way. You need to intervene and get help. This is something that we need. At the same time, there's also the stigma that comes around any form of a mental illness, that you think, well, if you've got a mental illness and we can't possibly put a responsibility on you, and if you're not feeling mentally well, how do I approach my boss and say, listen, mentally, I just need a break. Please, can I have some leave? I'm not feeling good that way. But if I've got a flu and I've lost my voice, there's no problem. I can go away. But if I'm mentally not well, I still can't do this. Where are we on that? I know we've progressed a lot, but obviously there's a lot more that still needs to be done to assist people with understanding the stigma and the fact that you need to help yourself and others around you.
Absolutely, Leanne. When a young person goes to his mother or somebody in the family says, "I'm hearing voices," people think it's spiritual or something culturally is happening into that system, which is wrong. Mental health is real, and my appeal to all employers, to parents, to guardians at this moment, you are listening to us, please watch those symptoms in your child, in your young person around you, or an employee around you. Mental health is real. It has a diagnosis. It is a disease. It is like any other disease. It's like blood pressure. It's a chronic disease, actually. It does not, it takes long-term treatments. Therapies are one form of treatment, but there are medications that really help you. And that's why we have a whole medical stream called psychiatrists, psychologists that spend their entire career of their life studying into how to resolve a disease and how to solve a disease. So yes, If you are in a doubt as an employer, you can always subject an employee to refer them to a psychologist, to a psychiatrist for help, because at the end, this help is around us. Yes, one of the challenge will always be is this adequate access of health around us? And this is a big question, and that's where governments needs to invest further into mental health, because access to health is another big challenge when it comes to mental health. So stigma is one, but access to mental health is another big challenge. So the aim is to look at the disease now in a 360 view: education, right from schooling system to parents and guardians. Watch your child, watch your young people. When I've told you 1 in 5 young people are extremely vulnerable to mental health or suffer from mental health, and that is absolutely real. Employers and employees, work stress, anxiety, panic disorders, traumatic disorders, these are all real. Gender-based violence is predominantly high in South Africa, and the biggest effect of GBV is on mental health. So when we look at the dimensions of us as a country globally, looking at where we find ourselves financially as a world, this mental health is only bound to grow. It's the biggest and the fastest growing pandemic, and it needs its importance, as you have highlighted, Leanne, and I'm grateful Morning Life's doing this.
Thank you so much, Prof. Always such a pleasure and a joy speaking to you here on the program, to realize that there is help at hand for people that are going through any form of mental illness. Professor Ramneek Ahluwalia, medical expert, talking to us, as he always does, from a higher health as well. That number there on your screen, that of course is the suicide line. So it's a helpline if you're feeling any kind of way. Believe me, if you're not feeling well, you can get help. You shouldn't be feeling that way. Get help and try and sort yourself out, because it's so funny when people are struggling with some form of a mental health issue, some people will say to you, why don't you limp? You'll get more attention that way. People will physically see it. Nobody can physically see your mental health issues except for you. So get yourself some help. There's that number, 0860 363636.